Welcome to Cancer Screenings. That's what we're talking about today. My name is Jenny Corrigan. I'm a registered nurse and have been one for more than 30 years. I've had 6 years of experience in quality, and that's what I do now. I'm a senior quality clinical quality management analyst for Highmark Health Options, but most of my career has been as a critical care nurse in surgical and trauma. So today we're going to talk about cancer screenings. And cancer is a word that scares us all. The good news is that routine screenings mean we can find it and treat it earlier. Screenings and improved treatments have contributed to drastic fall in cancer deaths. We have 30% fewer cancer deaths than there were in 1991. So thanks for joining today's webinar about screening tests for some common cancers. We'll answer some basic questions. What are the tests like? What age should you be screened? And what are your risk factors? We'll end up with an open community forum with Q&A with nurses and other healthcare providers. Our session always includes specific online and offline resources to empower you in healthy decision making. So what are cancer screenings? Cancer screenings are tests that look for cancer in people who don't have any symptoms. Some screenings may find growths and remove them before they have a chance to turn into cancer, like when you have a colonoscopy and they remove polyps. Other cancer screening tests find cancer early when it's easier to treat, and that would be like having a mammogram. Evidence shows that cancer screening is effective. So why is cancer screening important? Cancer is the leading cause of death for people under the age of 85. It is the leading cause of early death. Many deaths from cancer can be avoided through early detection, and still many people are not getting screened. Each year, there are 1.8 million new cases, over 600,000 deaths, and we have 11 to 18 million cancer survivors. So we're going to talk about some screening guidelines. The screening test for breast cancer is called a mammogram. Both men and women can have breast cancer, and you need to talk to your doctor about your risk for breast cancer. You have screening done between ages of 40 and 45. You start your yearly mammograms. At age 55, you can continue with your yearly mammograms or start having them every other year. You should have regular mammograms as long as you are in good health. And of course, screening tests are important because many people with breast cancer have no symptoms. Some of the signs you do want to look for, though, are changes in your skin, like redness or swelling in your breasts, changes in the appearance of your nipples or drainage from your nipples, or lumps in your underarm, and of course, lumps in your breasts. When we look at cervical cancer, the screening test for cervical cancer is called a pap test or a pap smear. Most cases of cervical cancer are caused by a virus called HPV, and we're going to talk about this on the next slide. But you should have a pap test every 3 years between the ages of 21 and 29. Between the ages of 30 and 65, you should have a pap test every 3 years or have a pap test and HPV test every 5 years. After you're 65 years of age, you can stop having pap tests if the last 10 years showed normal results. Women who have a high risk for cervical cancer may need to be screened more often. In 2021, we're going to see about 14,500 new cases, and more than 4,000 women will die from cervical cancer. So it's important that you get these screening tests. You're at high risk for catching the virus called HPV if you start having sex before the age of 16 or within 1 year of starting your period. If you have multiple sex partners, if you take birth control pills, especially for more than 5 years, smoke cigarettes, have a weakened immune system, or have a sexually transmitted disease. Now, there is a vaccine for HPV, and it can be given to boys and girls starting at 9 years of age, going to 26 years of age. The screening test for lung cancer is called a CAT scan or a CT scan. You have high risk for lung cancer if you are between the ages of 55 and 80 and currently smoke with a history of 30 pack years or greater. This means that you are smoking 1 pack of cigarettes a day for 30 years or 2 packs a day for 15 years or the equivalent. You also have a high risk for lung cancer if you are a former smoker who has quit smoking within the past 15 years with a history of 30 pack years or greater. If you have a high risk for lung cancer, please discuss screening with your doctor. Now, a CAT scan is a special kind of X-ray that takes three-dimensional pictures of your lungs while you're going into a machine. It's a large round machine, so it's not like an MRI that makes you claustrophobic. A CAT scan is not like that. There are several different tests that can be used to screen for colorectal cancer, and this is cancer of the colon or the rectum, and discuss options with your doctors. And I know you've probably seen advertisements for Cologuard, which tests for colon cancer, but this is only for people with average risk. Screening tests should begin at the age of 50. If you have a family history of other risk factors, you need to talk to your doctor about beginning earlier. In 2021, there will probably be more than 100,000 new cases of colon cancer and 45,000 new cases of rectal cancer. Okay, we're going to talk about prostate cancer now. This includes a blood test called a PSA or prostate-specific antigen and a physical exam. You need to discuss the risks and benefits with your doctor. If you have an average risk of prostate cancer and expect to live at least 10 years, you start screening at age 50. So I think everybody needs to start screening at age 50. Age 45 if you have a higher risk because you are African American or have a father or brother with prostate cancer, and age 40 if you are at even higher risk. In 2021, there will be about 250,000 new cases of prostate cancer, and more than 34,000 men will die from prostate cancer. So it's important that you stay healthy. You want to help lower your chances of getting cancer by changing the risk factors that you can control. Watch your weight, get to and stay at a healthy weight. Limit alcohol, have no more than 2 drinks a day if you're a man and 1 drink a day if you're a woman, and this just has to do with your body size. Exercise, have at least 150 minutes of moderate exercise weekly or 75 minutes of vigorous exercise. Keep moving. Limit the amount of time you are still, such as sitting, lying down, or watching TV. And avoid tobacco in all forms, including smokeless tobacco. And of course, we need to eat right. Choose portions carefully. Limit processed meats and red meats. Eat at least 2.5 cups of vegetables and fruits each day. And get screened. Talk with your provider about the cancer screening options that are right for you. Review your medical history and your family history to find out if you need to start testing earlier based on your personal or family history. All the information from today's session was provided by the American Cancer Society. Thank you for your kind attention.